look very locally. The shortage may be in, as an example, Knoxville, but there may not be a shortage here in Nashville. There may be a shortage on the East Coast, but not on the West Coast. So when we talk about shortages and overages, really, also, we really have to look from district to district, from region to region, to see what it is that is short. Do we have an overabundance here? There are those areas across the nation wherein there are lots of schools, so there are lots of nurses being produced, so to speak, from those schools. And in those areas, if those nurses, once they graduate, decide that they want to stay there, then there's an overabundance. And we may find that there are nurses looking for jobs instead of hospitals looking for nurses. But I think around in this area, we are probably right where we need to be where nurses are concerned. I don't believe there's a shortage here necessarily at this moment as I speak. Who knows what it will show in the next month, but this is where it is right now. And hospitals have different ways of handling that situation also. One of the things that happened in healthcare over the past few years or so, and most of the nation is aware of the fact that with healthcare the way it is right now and reimbursement and so forth, a lot of people are being sent home from the hospitals a lot earlier and sicker than they used to be, say back in the early 1980s. With that, nurses have found a place outside of the hospital. They work with health insurance companies. They have formed their own businesses. Some of the home health agencies that were very, very popular during the late 80s and early 90s were formed by nurses, and they were nurse-owned businesses. And over that period of time, with the establishment of the home health agencies and nurses leaving the hospital, so to speak, we have found nurses doing many, many other things in the community, because now nursing has gone to the community. We don't find nurses strictly in hospitals, and I think that may be a problem, or one of the things that most people think nurses are strictly in the hospital, and the only place they'll see them is in the hospital. When in essence, we're going to find nurses everywhere. They're in industry. You will find them, as I said before, working with insurance companies. You will find them working outside in their own businesses as consultants to hospitals, to schools of nursing, to other healthcare organizations. You'll find them working with volunteer organizations such as the American Heart Association. And I don't mean as a volunteer as I was, but as officers, not officers necessarily, but as a hired person within that organization. Right. I believe nurses have a lot to contribute to just about any walk of life, because in any walk of life, healthcare is really an issue. And nurses are on the forefront when it comes to that. Nurses are in various areas. We specialize. My specialty, for instance, is cardiology. We have nurses who specialize in pediatrics, in OB, in labor and delivery, in medical surgical nursing, in neurology. So nurses have a particular background, specific backgrounds that allow them to move freely across many walks of life and be very, very product-oriented and be producing people when they're in those organizations and with those groups.
In other words, over the last many years, the status of nurses have changed tremendously in perception. And the perception of how we see nurses. Generally, most of us think in terms of a nurse assisting a doctor. And what you're saying now is that nurses are healthcare delivery persons, and they might be found anywhere you find a doctor or anybody else. Is that
Once upon a time, nurses were called the handmaiden of the physician. That is no longer so. Nurses need to and do work side by side with the physician. We have to remember that nurses are in the hospital 24 hours a day. They have the most intimate contact with the patient. And how often, when the patient becomes ill, how long rather, is the physician with that patient during the day? Maybe a limited 5 to 10 minutes if there's not an emergency. So it's that nurse who truly learns what's going on with that patient, what's happening with the family, how those activities with the family may be impacting that illness, and working alongside the doctor, work with that doctor and tell the doctor, hey, this is what I found out. Do you think this is a problem, and what can we do about it from your viewpoint?
And of course, that gives a much broader. As a matter of fact, I think, Dr. Stringfield, your position here as the program director, BSN program director for the Tennessee State University School of Nursing program, I think that sort of illustrates the kind of activities that nurses are involved in, and some of the things that you've already said that you've been involved in, not only as volunteering, but also as a paid staff person in those areas. I think that that illustrates that nurses do more than simply assist doctors. And of course, when we come back, we're going to talk about the nursing program at Tennessee State University, and we'll be back with our audience following this short commercial break.